morning, everyone. Today marks 318 days since it started, when we had our first two cases back in March 12th. Sadly, we're announcing two more people passed away from COVID-19 last night, a woman in her 80s, a man in his 80s. That now brings our total of people passing away from this 295 since the outbreak started. My condolences and prayers go out to the family, to the 293 families that have gone through this. It's tough. It's tough to lose anyone. It's tougher to lose someone in COVID-19 and say goodbye to them. Unfortunately, this now brings us to 69 people that have passed this month. Last month it was 66. This is officially now our deadliest month that we've had since this virus started 10.5 months ago. And it's hard to believe that 11 months is just right around the corner. I've said this in the beginning. Dr. Whalen and I have pointed this out since Halloween, since October 31st. Our spike's going up. Travel was going up. People were letting their guard down. People were over COVID-19. COVID-19 wasn't over you. Vaccine comes out. People think they're going to be safe and they can go out again. People who get the vaccine think they're good. They can still spread it. So whether you get the shot or the second shot, you still get it and you can give it to other people. If you had COVID-19, doesn't mean you don't have to wear a mask. You still have to wear a mask. You still have to socially distance. Cough into your arm, clean your hands. We'll get through this by staying vigilant. We'll get through this by working together in a partnership. But we're not going to get through this if people continue to let their guards down. It's been a trying month. And now when the governor, the CDC, and the World Health Organizations talk about the new strand of the virus coming, and it could be the deadliest month we've seen coming up in March, or we could see this continue to morph and continue to keep us in the situation we're in. It's hard. That's why I said 11 months ago that it's a marathon, not a sprint, that we need to take a deep breath and we need to realize the world around us has changed and we're never going back to the way things were. Society has changed, work environments has changed, day-to-day has changed. Mental health of a lot of people have been challenged, will be continued to be challenged, especially for youths and children. I know Dr. Whalen will talk a little bit about the sports. But I'm complex. I spent the weekend talking to my counterparts in Schenectady and Rensselaer and Saratoga. I played phone tag with, that we are at the highest infection rate that we've had since this started, the highest. And hospitalizations and everything else, and yet let's go play sports. I don't know. And look, I've said this, I'm not here to get votes. You don't want to vote for me? I don't care. You want to vote me for our office? Go right ahead. I'm here to save lives and do what I'm supposed to do. So yeah, I'm going to make unpopular decisions and I'm going to do things that you're going to be mad at. But I'll take it. I'll take it because I have to sleep at night and I got to put my head on my pillow. And I have to know that what I did wasn't based on politics or me getting goddamn reelected. It was based on the science and based on dealing with doctors like Dr. Whalen and people running health departments who have trained for this for years. So please, there's a lot of guidance we have to get through. I can't have another youth football coach or baseball call me. I can't give you that answer right now. We have to do our due diligence for the people that we represent here in Albany County, which is roughly 320,000 people. There's 1 million people here in the Capital District. You got about 160 in Rensselaer County. You got about 150 in Schenectady County and roughly over 200, probably 220 or 30 in Saratoga. Bear with us. Let us do our jobs. Let them figure this out, because this got thrown at us unannounced and said, oh, here you go, county, you decide. Health departments, which really lies with Dr. Whalen. So today we have 17,166 cases, increase of 193 positive cases. That now brings our 5-day average to 229.8. Yesterday it was 228.4. There are currently 2,768 people under mandatory quarantine. Yesterday the number was 2,840. We have 41 had close contact with a positive case, 3 are healthcare workers, 149 don't have a clear source of infection at this time. As of today, 50,850 people now have completed quarantine. Of those, 15,362 were positive with COVID-19 and have recovered. That's an increase of 144 recoveries since yesterday. Unfortunately, there's 10 new hospitalizations overnight. We currently have 165 people currently in the hospital from the virus. Yesterday, that number was 172. 15 patients currently in the ICU. Yesterday, it was 16. The Capital Region bed capacity is now down to 24%, where we were a couple weeks ago, and our ICUs at 19. Based on the other regions of the state, we are now at the lowest. We are the lowest here in the Capital Region for hospitalizations and ICUs. We're having the most unavailable beds than any part of the state of New York. That's why we did the partnership with Dr. Reed and St. Peter's Partnership. Thank God we don't need to open up that part of our old nursing home, but it's ready to go if we have to. So keep that in mind. Continue to say to people, please wear your mask, cough in your arm, clean your hands, 6 feet apart, and we'll get through this if we continue to do it. I don't want to break any more records. I don't want any more people infected, and I don't want people to continue to get sick from this. And the long-term effects, even when people recover. New York Times had a great article today I read, very lengthy but very educational, about people recovering from COVID-19, whether they were intubated or whether or not they end up in the hospital, and how it affects females versus males, and the long study of different hospitals and going forward. If you get time, read it, educate yourself. That's what I continue to tell everyone. For those who want to get the vaccine, please check the eligibility. You can call the state's number at 1-833-697-4829. Thank you to Pete Gannon and United Way for the 211 number. Call it. It's simple, 211. We're working on things too to move forward with our next pod, but to United Way, thank you for the partnership. Simple, call there. They'll walk you through how to fill an application out online. They'll walk you through who you got to call, if you got to call somebody, and try to help you select sites. So it's been very successful, and we'll have to bring the numbers in, what they've been dealing with. So, we did get some good news over the weekend about our equity agenda, what we've been advocating, Dr. Whalen and myself, and Mayor Sheen and everyone else, Supervisor Paul Mahan and Mayor Patrick Salary, and I could go on and on and on. I don't want to leave anyone out, about getting into the most vulnerable population here in the county for vaccines. It was nice that they announced they'll be at the church, the Pilgrim Church, tomorrow in Albany, 2410 Brook Street. Sweet Pilgrim Baptist Church, I should say. Federally supply of vaccines is increasing, so they'll be doing two rounds of 200 doses tomorrow, one at 10 a.m. and at 3 through Whitney Young. It's great that we set that partnership up with Whitney Young, and Whitney Young will be doing the administrative side, but there's no number I can give out. I don't know how they're handling that. They're doing it internally. There's nothing on their Facebook, so they must be doing it internally through people that go to church there in the neighborhood. So, but it's good. One of the things we've advocated, and that's why I did the partnership with Mayor Sheen and Mohawk Ambulance, that we can do 300,000 vaccines, not just here in Albany. So I want to make that clear. This is for Schenectady County, Rensselaer, Saratoga. That partnership was to benefit the Capital Region, because they're not going to be able, 300. There's roughly 320,000 residents. When you take out the children, so that partnership was for the whole Capital District, and getting shots in the people that we continue not to look at, people that are vulnerable, living at home, that can't get out, that are falling in a nursing home setting or a state-run facility or anything like that, that may have a variety of different health issues why they're not getting out, so we can get to them, get the shots in their arm, and to the seniors 75 and above that aren't getting out, haven't come out in March, and I think people know a lot of their neighbors that haven't got out. So please, I'm glad that the governor's going to do it, going to reach out, but we did all the work. Dr. Whalen and our team, my office, thank you to my office, to my deputy, Dan Lynch, and Jeff Jameson, and George Penn, and everyone. I mean, I could just go on to the amount of work that we've been doing, and I do want to say this, that it's there. The data's done. Just work with us. Work with us. Because, again, it's a partnership. Let's let the left hand know what the right hand's doing, and we'll get through this working together in a partnership. So, I'm looking forward to having our own vaccine sign-up system. We're working it out. Dr. Whale and I were talking last night. I'm sorry to bother you on a Saturday, too. But it seems it doesn't matter if it's Saturday or Sunday, what day of the week it is, I'm calling you. But we're getting through it, and we're going to simplify the process and make it easy, a variety of online versus call-in. Because, again, there's a lot of people that aren't computer savvy, or they can navigate the website, but they just don't understand the website. And I actually went through it again, and it's kind of alarming, and we got to simplify it. You got to make it easy for people, not difficult. You know, and you know, we're going to do that. So I look forward to working with Dr. Whalen and her team on that. But also, I want to give her a huge shout out to do over 800 people on Thursday in less than 4 hours, and I'll let you talk about it, because I know you did like 245 people in less than 2 hours at one point. Seamless, great experience, and that's what we want. We want people to come in, not feel aggravated, not feel stressed out, and some people are stressed out enough because they got to get the shot, but to get through the process and the friendliness, and it's about customer service. So Dr. Whalen, to you and your team, as always, thank you, but I'm going to stop there and let you, Dr. Whalen, talk about everything. So thank you.
Good morning. So there's a lot going on right now, and I'm going to try to go through things systematically. So first of all, in terms of looking at what our rates look like, we continue to see high numbers of cases in the community. We continue to see high levels of community spread. This is the most important thing that I want to say, because we need to really retain the knowledge that the behaviors that we have been discussing since this started are more important than ever. You need to protect yourself, you need to protect your family, you need to continue to wear masks, you need to continue to practice careful hand hygiene, and to avoid any large gatherings. These things are essential to preventing spread in the community. In addition to the high numbers that we're seeing, we know that we have in our area identified cases of the new variant, which, as we know, is more highly communicable. And there is one paper out, although there's not enough evidence to suggest with, or to say with definity, that this strain is more deadly. We do know it's more communicable. And because it's more communicable, it will lead to more people becoming ill, and more hospitalizations, and likely more deaths. So that we can say, and that is a particular concern. Also, people want to know how many of those cases do we have in the community, and that is not something that we can quantify, and I'll tell you why. Because every single COVID test that is positive is not being tested for the variant. We are testing either those that we know had contact with an individual with a highly suggestive variant, or there are certain tests that are being collected for surveillance. But because this particular genetic sequencing takes so much time, it is not something that can be performed on every single COVID test. So for the public to expect that we can give accurate numbers of how many cases are out there is not an expectation that can be fulfilled. So people need to know of that. If they say, well, there was just 1 or 2 cases, we don't know. It is likely that there are more, and if they're in our area, that is a concern. So these are the things at the moment that I'm concerned about, also looking at our hospitalization rates and our ICU rates. These are levels that are much higher than we saw at the beginning of the pandemic and at the time where we had a statewide shutdown. So that is something that everyone should be aware of, and everyone should base their protective efforts on that knowledge and not the knowledge that you know, there isn't currently a statewide closure. So I would urge the public to focus on those numbers and that knowledge and let it guide them in protecting themselves. The second thing I want to talk about is vaccination. And we had a great clinic on Thursday night. We were able to get 800 people through. And I'm really grateful to the fantastic staff and Medical Reserve Corps that continue to work with us. We really do have a finely honed operation for getting vaccine out. The concerns for us and the challenges are around scheduling and around the fact that we don't have enough vaccine supply at this point. So last week we had 800 vaccines. Overnight, I learned that we will get 800 vaccines again this week. And there is a very specific prioritization that we are asked to use our vaccinations for. And this is something the public should be aware of as well. The hospitals have been charged with their vaccine efforts for doing the 1A population. So those are the frontline health workers, the hospital workers that are taking care of COVID patients and others. The local health departments have been charged with vaccinating the 1B population. These are other very essential and important workers in our community and include police and fire and teachers and grocery store workers and other unions. This is where we must focus our efforts. This has recently been made an executive order. So we are charged with the vaccine that we get to vaccinate that population and that population only. When you talk about the senior population, those over 65, that group will be handled by the large-scale pods that have been set up, such as the site out at SUNY, and by our pharmacy partners. And I'm very happy to say that our pharmacy partners are starting to see vaccine come to them, but the numbers, again, are not high. I've worked with several independent pharmacies in the area to provide a standing order and to provide Medical Reserve Corps if they need additional support with vaccine. This is something that we expect to continue. But what the public needs to know is that the vaccine supply is not anywhere near the demand. So it's really important that people know that we all need at this point to remain patient. Everyone, understandably, is clamoring for the vaccination at this point. Not everyone. I will say there are people that want to wait, but we are tasked with communication around those that really want to be vaccinated now. We understand many of you have been in your homes for a long period of time. We understand grandparents want to see their grandchildren again. We understand you're concerned about relatives that may be sick, that may need the protection of the vaccine. We understand all of these concerns, and as quickly as we get vaccine into our hands, we are getting it out to the public. That is our charge, that is our duty, and that is our commitment and contract to you, the general public, to get that vaccine out as quickly as possible. Every vaccine that comes to us, and when I say us, I'll speak for all the regional hub providers, so that includes the hospitals, it includes the health departments, it includes the pharmacies. It has to be gotten out. Vaccine is not hanging around anywhere. We get it out as quickly as we possibly can, and it's always by the end of a week. So, we hear about our supply, we start to make appointments, and we give vaccine out. All that happens within a 3-day period for us at the local health department. And this is our commitment. We will continue to operate these pods, and we will also be looking at other ways that we can assist with members of the community who may not be computer literate, who are essential workers. So this is something that I've discussed with the team over the weekend, and we are looking to put a plan in place where we can have other methods to schedule appointments for those that may not be able to schedule via the computer, and start to implement that this week. It is essential that we provide these doses with equity, and that is why we want to make sure, as we get information out on our scheduling, that we get it to all the partners that we are looking to work with, so that everybody has a chance at the same time to get those slots. This is something that has been a challenge. It has been a challenge for the last 2 weeks, and the system that the state has employed has unfortunately been difficult to secure those links. Links are shared very quickly once they get out, and we need to control that. The CDMS system is the state system, and the state is working on improving that. And over the weekend, there's been a couple of updated documents in that process. So I know they're working very hard too. And together with them, we look to come up with a solution so that the scheduling can be as equitable as possible. As many vaccines as we can get out. That is what we have practiced. That is what we have prepared for. That is what we have drilled on. And I will speak for my staff, and I will speak for the county and say that the feedback, I have been on site and working at every single pod, and the feedback has been universally positive. People have been very grateful. They have gotten through very quickly. There has not been any hassle with people coming through. We have had instances where people come in with documentation that is not part of our system, and unfortunately in those situations we have had to send people away. If people were given either a link that wasn't on our system and they are an essential worker, we make an attempt to try to get them scheduled for the next clinic. We really do want to work with the public on this, but it is going to be essential that people understand that they need to have patience, because the supply simply isn't here yet. And this is the hard part for all of us, is having patience. As the supply, we hope, picks up in the coming weeks, we will scale up our efforts as we need to. We're ready to do that. We're committed to do that. We want to do it. We also have staff that are very busy still doing case investigation and working on outbreaks in the community. So it really is a full court press at the health department, and I can't speak highly enough about the staff that I work with. I think that in times of challenge, people tend to show their true colors, and I couldn't be more proud or excited or happy to work with the staff that I have at the health department. Everybody is working extra hours, everybody is doing what is necessary, everybody is being nimble if changes need to be made, and everybody is really doing the best that we can to make this a positive experience for the public in terms of the vaccination and in terms of education. We know we continue to have work to do. We know we have to work with our minority communities to ensure, because at this point, we have not really gotten to the point where we're seeing people that are hesitant to receive the vaccine. We are more tasked with the multitude of people who are clamoring for the vaccine. But they're there, and they need the education and the support and the encouragement that our staff can provide to ensure that there is equitable distribution of the vaccine, and so that people can get the education that they need to feel comfortable about it. That is a challenge for us, and that is something that we are committed to doing. And we are working very closely with community partners and with the hub on strategies to employ education and to work with community leaders. This is essential. So we're committed to all of these things, and really ask that the public, to the extent possible, understand the concerns and how we are doing our best to try to address the concerns each and every one of you have, the need for patience, and maybe the need for kindness and compassion as well. It's not an easy time. It hasn't been easy for any of us. But we really are committed to going forward with this and working to the best of our ability. Finally, I'll mention the sports. So this was something that I became aware of Friday at the same time everybody else, that the decision on school sports would be left to the county health departments. I don't have decisions at this point. What we are doing and what I've been doing over the weekend is circling with my partners at the New York State Association of County Health Officials to ensure that we can do this in a systematic and uniform manner. It's not an easy decision. As I stated at the start of my remarks, we are seeing higher rates than we ever have. We are seeing the risk of a more highly communicable variant. This is a difficult time. I understand it's difficult on parents. My son lost his senior year this spring in sports, and I have a daughter who's a junior in high school and who plays sports as well. So I'm a parent, and I understand the concerns. I understand how much parents want their children to be involved in sports, and how much The children want to be involved. The kids want to be involved. This is very important to them. But we need to balance these risks very carefully, and people need to be informed. People need to go into this with knowledge, and with knowledge that the importance of this extends beyond your immediate family. It extends to the community. It extends to people that could be put at risk. So these are things that we're working with. We have a meeting scheduled later this week. As you know, the decision is earmarked for February 1st, so there is some time for us to really gather the data and decide how to move forward with this. And I will give you my word, it'll be through due diligence and science that these decisions are made.
Thank you, Dr. Whalen. A question I do have for you is explain to people that if they are COVID-19, quarantine, or positive, what they should do if they're signed up for the shot.
Don't come. If you have COVID-19, you should not be vaccinated. So if you have been placed on isolation and you have a positive test, either of those things, please do not keep an appointment to be vaccinated. You're putting other people at risk. And if you have active COVID disease and you are vaccinated and you become sick after that, it is difficult for us to determine whether that was due to the disease or the vaccine. So it is inadvisable if you have COVID-19 to come to us, and you will be turned away.
Thank you.
The second is if you're quarantined. If you have been identified as a contact and you are currently on quarantine, this means you may be potentially communicable. So do not come to our clinic. If you come to our clinic and you tell us you're on quarantine, or we know you're on quarantine, you will also be turned away. This tends to put other people at risk, and we operate our pods with very close attention to infection control, spacing people apart, and making sure that people come in are masked, making sure that our staff and our Medical Reserve Corps are appropriately protected. Please do what you can to ensure that our staff are protected and that you're not contributing unwittingly to the spread of the disease.
Thank you, Dr. Whalen, because we do have that happen more than we should. So again, people have to educate themselves, and we need to do ourselves in government a better job of getting out the do's and don'ts. So we are rolling out a PSA commercial this week as well here in Albany County. It'll be one of two that will be going out. I think it starts tomorrow, matter of fact. The PSA commercial will be out. And please, people, educate yourself, do the right thing. And if you are under quarantine, I know you want to get that shot, wait, especially if you have COVID-19, because we can't have you there and put it out to other people. But Dr. Whalen, thank you again for your leadership and everything else. One of the things we talked about is the financial impact this is having on the community as a whole. You did a story on the unemployment rate for restaurant workers and everyone else that we've been that's the hardest hit area out of anyone being put out of work. And one of the issues that has been addressed on the federal side by President Biden and by the state here was no rent. People don't have to pay rent. That'll be coming up on a year. I think they started May of last year. So we're, it's been going on for quite a while now. And they're going to extend eviction notices, and rightfully so, to help people, to make sure they're not put out on the streets and homeless during these tough times. And we in government need to work with the people to make sure that they don't fall through the cracks. But the other issue we have too is landlords that don't typically own 60 apartment buildings or are making a lot of money. It might be a small investment. They might own a 1-2 family or a couple 2-family homes that now haven't got rent in 10 months, won't get rent in going through May, and they still have to pay their bills too. They still have to pay the taxes. And what's that mean to Albany County? Taxes. And it means that, as I brought this up before, that hotels and landlords won't pay their taxes, and that affects our budget at the end of the day. But it also brings up the reason why we need to work together to make sure that everyone gets the relief that they did. So I do want to thank NACO I want to thank County Executives of America, Mike Griffin, being president of County Executives of America. I got multiple phone calls around this nation, have been more so these last 10 months. It seems like my phone's attached to me at all times now. But the reality is we found out about relief for landlords. And we had to apply within 4 days. And I want to say to Michelle McClave and her team and everyone at DSS, thank you. Aaron Stakowitz, they turned this application around with less than 3 days. We applied for it, and we received, for relief for landlords, $9 million and got the check on Friday. So we have $9 million for landowner or people that own apartments of $9 million relief on Friday. It was huge. Any county in the state with over 200,000 people could apply for it. If they didn't apply for it, if your county did not, or you did not know about it, it goes to the state of New York. The state of New York will be able to take the money and do the same thing we're going to do. But what does it mean? It's going to be run through our DSS. It's going to pay back up to 12 months back rent and 3 months of future rent going forward. And here's some of the requirements. So I can't roll them all out, but some of the requirements are for eligibility. Anyone unemployed for 90 days or longer. Those below the 80% of medium income area. But however, I want to point out, however, we are going to concentrate in Albany County people that fall below the 50% area of medium income. This is something I was talking to Chairman Andrew Joyce, and I want to say to the chairman, he couldn't be here today. He was going to come down with me and talk about this, something that they were focusing on, we are focusing on with everything else. But Chairman Andrew Joyce, thank you. He is going to carry this legislation. It will probably be introduced to the legislature as a Rule 11, and Andrew will deliver it to the Audit and Finance Committee to get voted on, because we do have the $9 million. So the quicker we get moving forward, the quicker we can get this done. But again, this is not for public housing tenants and or mortgage payments. Unfortunately, people that have fallen back on their mortgage. This is just for landlords, and it's also going to be applied for lights and electricity, or lights and heat and stuff like that. This money can be applied for, which falls into our heat program and a variety of other things. But it is a huge success, and I cannot thank Dave Riley, our budget director, everyone that was involved with this, because when I sit there and tell you it was no small accomplishment, they turned this around in 3 days. Very proud of all of them, and the fact that we got a check on Friday for $9 million kind of, be honest with you, blew me away, because usually when you get money from the federal government, it's down the road, you're fighting for it, you're waiting for the check. The fact that we have the money in the bank ready to go to roll this out is going to be so helpful to the small landlords. And like I said, this, it's going to be a lot of restrictions. They're going to have to fill out some paperwork, and we're going to be running this program as we figure out all the logistics. But it will be relief to the landlords that have so hard fought for relief to them, because again, it's not like they're all millionaires. It's not like they have money sitting aside and they're going through their savings to keep their properties afloat while they don't have income. And this also, again, helps people unemployed and people that can't pay the rent, and it makes it easier for both sides. It's a win-win situation. We took care of the tenants, now we're taking care of the landlords, and that's government working in a partnership for the people, and we can get it done. So again, to my whole team, I'm proud of you, and to the partnership with Chairman Joyce and the legislature, this is going to be a great partnership going forward, again, to help the people of Albany County and the business owners, because again, I want people to do business in Albany County, and I want them to know that we want them to stay here, we want to expand their businesses, and we want them to live here, but most importantly, I want them to know that they have a partner in county government. So please, people, Whitney Young, you can call there for an appointment if you don't have insurance. If you have insurance, please, 518-465-4771. We cover the cost as always. University at Albany, same thing. You can schedule an appointment 188-364-3065. And again, you go to albanycounty.com to see the different sites and everything else, and you can find out the wait times and everything. It's not updated every day, Yes, Cam, I got in trouble. They're like, not every day, because people have, believe it or not, and I'm glad that people call us out on that and say that, I went on there and hasn't changed for 24 hours. So it's usually updated every 24 hours, give or take, he's saying. So you can blame Cam for that if it's not updated. But again, mental health support, please call if you need it, especially with the kids. I know it's difficult times, and it's hard on the kids, and I get it. And parents just want their kids to get back to some type of normalcy. It's hard on everyone because people are on edge and arguing more and challenging one another. Trust me, we'll get through it. This too shall pass, and just be glad that someone you love isn't sick or passed away from this, or someone you know that's unemployed that lost their whole livelihood due to being shut down, or due to the fact that the way restaurants are operating, everything else. So please take the time to reflect on your own life and realize it's not that bad. You're doing okay. And especially if you're an essential worker, you got a paycheck coming in, you're paying the rent, you're paying the mortgage, and you're putting food on the table. Think of the people that aren't. So please, parents, not just for you, have your children, call this number, 518-269-6634. We'll get through it. We'll get through it. And to the parents again about sports opening February 1st, please just give Dr. Whalen and her team and my team time to siphon through this, look at the science behind this. We got questions, whether saying sports are a low impact. We just want to see the data from the Department of Health and why they're saying this can carry on. And again, because it's, unfortunately, I was hoping that at this time you wouldn't be seeing me anymore, that we'd be going on and getting back to life and opening things up. But unfortunately, we're going to be this way for quite a while. So bear with us. And to anyone that needs our 24-hour sexual assault hotline number, please call 518-447-7716. And the New York State hotline, as always, please stay safe out there, stay healthy, do the right thing. Remember, it's a partnership. Wear a mask, cough into your arm, clean your hands, and stay 6 feet apart, and we'll get through it.